Okay, so today we gathered here for the AKP discussion, AKP, that is MRCPCH part 2 discussion. So whatever you have any queries or you have any doubts about the preparation, we will discuss today, okay? So first of all, let me finish my classes, then you can open your mic and then you can join our session, okay? You can ask any query. Okay, so first is AKP is MRCPCH part 2 exam, right? And as well as part 1, AKP also has two paper 1 and paper 2. But the main difference is that paper 1 and paper 2 pass mark is together. I mean, suppose if you did not pass part 1, paper 1, you did not do well, okay? But you did very well in paper 2. So the pass mark will be equal, okay? So passing AKP is comparatively easier for me because part 1 is actually has two paper, that is paper 1 is FOP and paper 2 is TAS. So part 1 examination actually a little bit lengthy preparation because you have to pass separately FOP and TAS, and also you have to do a lot of theory for part 1. But for part 2, there is very little theory, but the practical points are very important. We will discuss today what practical points you will remember during examination, okay? So while I'm starting, is there anyone has any question related to AKP? You can ask me now. Okay, so this is the books. These are the books. First of all, radiology book. Just you see the pictures of the book so that you can download from Telegram channel. So this is the radiology book and clinical cases for AKP and MRCPCH for neo format. Okay. Then this is the new guideline, pediatric and neonatal guideline, and this is statistics for MRCPCH. Then this is the very old book, practice exam. Okay. Writer is Gilles Kendall. Okay, this is a very old book, but in this book there are some important data you can read one time. And this is the applied knowledge in pediatrics master course. This book is newly launched for AKP. This book is actually a short version of Science of Pediatrics book. Okay, it is a short version. So any, like in our part 1 teaching sessions, we read line by line from the Science of Pediatrics book, every corner. So for them, this book is actually nothing for them. Who have read the, I will request everyone to mute the mics, okay? Because we can hear your family voices, okay? So for the students who are doing part 1 with this book, like Science of Pediatrics book, for them, this book is actually very easy if you read one time. But this book has many boxes, like, you know, very interesting questions boxes and some pictures, some radiology, some ECG. So this is a very short book. You can say it is a short book for AKP. It is a theory book. Previously, for AKP theory, we used to read survival guide. Still, I will say survival guide is very good book. But applied knowledge in pediatrics, this is a new book. So RCPCH will try to give question from this book. So you have to turn the speaker. Okay, everyone can just confirm me, my voice is clear or not?
Yes, ma'am, clear.
Okay, so the students
Yes,
who
ma'am.
are not clear, that means from your side, internet is not good, okay? So you can rejoin, okay? Because my internet is very clear, I think, okay? So this applied knowledge in pediatrics book, it is a short version of theory book, okay? Short version of Science of Pediatrics book, but you have to read it because question will come from this book. Okay. Now, any confusion about books? So whatever I showed you, those are the books that is important for AKP preparation. Okay, 7 to 8 books. You will say that, madam, is that enough? No, this is only 50% of the question will cover these books. So what are the rest 50% of the questions? Rest 50% questions will be palliative, will be ethics, will be pharma, and will be pictures. So from where I will read this? Now for this, you need some guidelines, some seniors who will tell you from where to read these topics. Okay, because pharma, palliative, ethics, pictures, these are vast, very, very vast. But what you can do, you can read last 10-year recall. In the last 10-year recall, see which type of picture is coming, which type of palliative or ethics question are giving, which type of pharma question are giving in AKP. You can do that. But for an organized course, you have to join someone. Okay, if you need, everything is ready for you in the table. Okay. Okay, why this Facebook channel is very important? Because in this channel, our team, usually we upload all the related important stuffs for MRCPCH, like for part 1, for AKP, for clinical, for DCH, whatever the Royal College exams, okay, except PLAB, all related to MRCPCH and DCH, we upload here in this channel. Suppose the exam is tomorrow, we upload here. Exam booking window is open, we upload here. Okay. Suppose some new guideline came, we upload here. So this channel is very important if you want to go to pursue your career in UK by MRCPCH pathway. Okay, so this channel is not only for for your course or something. This is for your updated knowledge. Okay. Next is, this is the Telegram channel. I know after this meeting, many people will message me, madam, where can I find those books? As I showed the pictures, you can go to your nearby, medical shop, medical market. Like in Bangladesh, we go to Milkhet. Okay, that is the place where we buy medical books. So in Pakistan also, in India also, there are some places where medical books are sold. So you can go there and you can buy those books are available. Okay. But if you need soft copy, you have to join this channel, my channel, MRCPCH with Tamanna. Here you can see the file here. Can you see this file section? Here is the link section. Can you see media section? Click the group, okay, and go to the file section, go to the media section and go to the link section. Everything that is needed for MRCPCH part 1, part 2 and part 3 clinical, everything is uploaded in this channel except my part 1, part 2 batches note that is exclusive for the students who will join the batch. Other than that, every materials, recall, sample paper, everything is uploaded in this channel. Okay, so you can get the guideline from this channel free. Okay, any question until now? Okay, very good. Now, your next question will be, madam, how I know I am prepared for the exam, or at least how many months I should study? If you already passed part 1, FOP and TESS, for you 3 to 6 months is enough. So for whom 3 months and for whom 8 months, 6 months? 3 months is for those students who passed a postgraduate exam in the country, suppose FCPS, MD. For them, 3 months AKP exam preparation is enough. For the students who did not pass part 1 or who are not doing any residency, any pediatric exam, for them, I will say don't rush, give exam after 6 months. Every 3 months, there is exam in the UK, every 3 months. So you you will not be in a race. You are not in a race. Life is not a race. Okay, study is not not in a race. In my part 1, part 2 batch, I have 56-year-old student. I have 26-year-old student. So you can understand 56 and 26, it's a huge gap. People are doing degrees at the age of 56. Some are doing degree at the age of 26. So life is a very easily taking thing. Okay, don't take your exam is a death sentence. You will be all time sad. Okay, so don't rush. If you think you are confident, you are doing postgraduate exam, you are a consultant in the home country, you are doing practice, you can give exam after 3 months. But if you feel you are new, you don't know much about X-ray ECG data, give exam after 6 months. Okay. In the exam, there are some common mistakes I will tell you today. Okay. So how you can avoid those common mistakes? What points you should remember in the AKP exam? Okay. So I will tell you today some important points. Okay. Rule number 1. So our AKP exam is 2 part, paper 1 and paper 2. Same question, same syllabus. What do you mean by same question, same syllabus? What do you mean by that? Can anyone tell us what do you mean by same question, same syllabus? What do you mean? Same question, same syllabus means, suppose ECG. ECG will come in paper 1 and also ECG will come in paper 2. Suppose X-ray. X-ray will come in paper 1 and paper 2. Ethics, pharma, palliative, statistics will come in paper 1 and paper 2. You got my point? So this is the rule number 1. Never miss ECG, EEG, data interpretation, pedigree question, as they are containing very solid mark. Okay, so never ever miss this question. They are just like math, just like math. Now when you practice in a group, if you practice with someone whose level is below you or whose level is as equal to you, what will happen? You will be misguided. Many questions you will solve that is wrong, and you will give exam that wrong answer and your exam will be bad. Always try to solve your question in a group that is very much experienced, more superior than you. Because I have seen lots of groups, they are discussing very wrong recall. Okay, sometimes I correct, sometimes I don't find any time for correction. Okay, so they are discussing wrong recall, they are discussing wrong answer. Okay, so that is very dangerous. Some knowledge is dangerous than no knowledge. You know that. So remember, while discussing recall, you need a powerful group and you need a most senior supervisor that will guide you. Okay, because wrong knowledge is more dangerous for you. Okay, always see the guidelines. Suppose any question you are not solving, any question you are not understanding, any question, go to the guideline. What are the guidelines? I have shown you the picture of guidelines. Other than guideline, just type XYZ condition NHS. Just type like that. Othoba XYZ condition in patient info. Patient info. So these websites are UK websites. Okay. Any doubt you have, just discuss, just go to the website, you search yourself. If you don't have anyone to discuss, if you don't have any group, just go by yourself. Self-help is the best help. Okay. So never miss ECG, EEG data, pedigree question, as they contain very solid mark. How you know which ECG is important? Now, for that you need to solve recalls. Also, you have to see the RCPCH, websites, that is RCPCH gives us the syllabus for theory exam. Okay, go to that syllabus. It is easily downloadable in the RCPCH website. Okay, see that which ECG is important. Overall, this RCPCH book, new AKP book, this book contains some pictures, ECG, EEG data. So solve those also. Okay. And in our class, what we do, we have divided every topic in a different lecture. For us, ECG is separate lecture, EEG is separate, data separate. We have 20 separate topics for discussion. Okay. Pedigree. For pedigree, you can go by survival guide. You can go by Science of Pediatrics book. These books contain a lot of pedigree. Okay, and how to interpret pedigree. There are certain rules, like by seeing a pedigree, you have to understand this is autosomal recessive, this is autosomal dominant, this is X-linked recessive, X-linked dominant, and Y-linked disorders or mitochondrial disorders. You have to understand by seeing the ECG. Okay, so if I discuss individual topic today, it will be very lengthy class. I don't want to make that. I will just give you an idea that what does the AKP exam contain. Okay. Rule number 2, any question, suppose in the exam, you are not sure, 50-50, just give an answer which suits you best and give a flag, not leave it, actually flag it. Flag, you know, there is flag, red flag in the exam, right? You already know. Flag it to the end. Flag it and come back to the end. I will say flag it. Okay, don't keep it blank. Okay, flag it, because if you keep it blank, what will happen? What will happen? Maybe you do not find time for revision. That mark will be cut down. But if you are 50-50 sure, you should, at least you should answer the most correct one. And you should flag it. Don't keep it blank for the end. What will happen? If you keep it blank for the end, your mark will be cut down. This is rule number 2. Rule number 3. If you are not confident about the pedigree, ECG, audiogram, you are not confident, leave it for the end. At least there will be 8 to 10 questions for pedigree, ECG, EEG, okay? Leave it for the end because there is more theoretical question in exam. Okay, suppose 40-60, 40% will be pictorial. 40% is pictorial. Okay, other than 60% is data interpretation, scenario based. So solve those questions that has no picture, no ECG, no pedigree. Okay, solve those questions first. Okay, but remember, AKP exam is full of pictures, full of data interpretation, ECG, EEG, full. And it's a very big exam. Trust me, it's a very, very big exam. People fail just because of time management. They cannot manage time because they are not expert in ECG, EEG, pedigree. So they waste a lot of time for those questions and they fail. Okay, the students who fail in AKP, I will not say they do not have any knowledge. I will say they did not manage time well. Okay. Rule number 4, from each paper, there will be recall, repeated recall. But if you think recalls are enough to pass the exam, you are very much wrong. You are absolutely wrong. If you don't read guideline, if you don't read neonatal guideline, if you don't know how to manage neonatal sepsis, neonatal jaundice, neonatal hypoglycemia, neonatal convulsion, in any way you will stuck. They will change the recall. They will not give you the exact recall. Okay, they will change the option. They will change the age of the child. They will change the scenario of the child. So it is not, suppose cephal hematoma. Cephal hematoma will come as a question of complication of neonatal jaundice. You know that cephal hematoma causes neonatal jaundice, but you forgot other options of cephal hematoma complication. You forgot other option. And in the exam, you see there will be no neonatal jaundice. Other than neonatal jaundice, there are some. Suppose methylphenidate. You know, methylphenidate can cause growth suppression. But is it causing hypertension or hypotension? Is it causing excessive sleepiness or insomnia? Is it causing convulsion or tic disorder? You don't know because you did not read well. You only solved recall. You know methylphenidate causes growth suppression, but you don't know methylphenidate has other complications too. Right? So remember, don't blindly follow recall. This is very wrong. This is very, very wrong. Follow theory parts of the book, whatever book you are reading, if it is Science of Pediatrics, if it is Survival Guide, if it is AKP New Book, whatever book, if it is Survival Illustrated Textbook, any book that contains theory part, very important. Especially for AKP, neonatal guideline and pediatric guideline, very, very, very important. And we have extensive class, trust me, in our batch, students get tired after the class because extensive, each and every guideline we discussed in our class. And it is lengthy discussion because I don't want any point you miss in the exam. Okay. So recall will be repeated, but you have to know that they will change the option. So you have to know, suppose if you are reading neonatal sepsis from the recall and then from the guideline, then it is best. That means you are prepared for the exam. You are reading recall, also you are reading the topic from the book, then it is best. Okay. And remember one point, if you look for 100% mark, you will get at least 90% mark. But if you look for pass mark, you will not pass because our expectation should be high. Okay, I will try to get 100%. Then only my numbering will be 90%. Okay, my target is not just to pass exam. My target is to get very good number. Although this number has no value in exam, but it will give you confidence that I know many things. Okay. Rule number 5, rule out method for questions you don't know. Suppose there is a question about daydreaming. You don't know what is the difference between daydreaming and absence seizure. This is a very popular question in AKP, right? Daydreaming and absence seizure difference and complex partial seizure difference. You don't know what is daydreaming, you never read. But you know that in case of seizure, patient becomes unresponsive for some time. So you did cut mark, you did a cross that patient is unresponsive. In daydreaming, this is cross. Because in daydreaming, patient does not have unconsciousness. You cut down this one. This point is rule out. This is called rule out option. So there are 5 options. In one question, A, B, C, D, E, there are 5 options. You have to choose one option in between them. What you will do, you will rule out one by one. Lastly, you will see only 2 options you are confused. Only 2. So there is a 50-50 chance. Then go back to rule number 2, 50-50 chance. Whatever you think the best answer, you put that answer and you mark a flag. Why you mark this flag? If you have time, you will come back to this question. But if you don't have time, you put down flag, it means nothing. It means nothing. Okay. Trust me, in our classes, some students pass exam, they did not pass any exam in the country. And they are out of the study for last 10 years. I have few students like that. They did not do any training. They are never going to any postgraduate training or exam, but they pass in one chance because of these tricks and tips. And of course, the knowledge that is shared. Okay. So rule number 5 is rule out method, one by one by one. Okay. If some question is really difficult for you, you don't know the answer. Okay. Rule number 6, never do discussion between papers. What does it mean? Never ever cheat. Never ever cheat. Cheating is not only bad for exam. Cheating is bad for every part of your life. Trust me, I teach sometimes the ethics in my class. Okay, if you cheat someone and you make some loss of that person by anyhow, suppose you are sharing the records, you are sharing the notes that was prohibited, you are sharing them. You know, this cheating will come back to you somehow, someday. It will come back to you. Someone will cheat you same like that, and you will be in a loser position. Okay, so don't ever cheat anyone, any person. Okay, so never do discussion, never do cheating in the exam hall. This is prohibited. Never use mobile. Suppose mobile using is prohibited and you took the mobile in your pocket and you think nobody is seeing me, but actually in the video monitoring there is a, you know, there is a camera above your head. You are not seeing the camera, but you are being observed, and this camera record is sent in the RCPCH. In every theory exam, what you are doing, it is being recorded. Even if you are giving exam in your home from your laptop, they are recording your video. So your way of seeing in the front, in the back, in the side, they are recording, and they will permanently disable you from giving the exam. You will never give the exam. Even you will never go to UK. You can never go to UK in your life. You can go, but not as a doctor, as a other profession, because it will be notified in the GMC that this person, this is the passport number. Okay, this person did this cheating in the exam. So never ever try to do cheating. If you fail, it's fail. If you pass, it's pass. Okay, this is rule number 6. Now, rule number 7. There is always one or two major hint in each scenario. This is very important point. Suppose in the neonatal hypoglycemia, how will you manage? Will you give Bakkal gel? Will you give sugar containing drink? Will you give IM glucagon? Will you give 10% dextrose in aqua 2 ml per kg? There will be a hint in the exam. Okay, suppose a case of neonatal sepsis. How you know this is sepsis, or this is metabolic disorder, or this is hypoxic ischemic encephalopathy? They will give you some clue like mother had leaking of membrane for 20 hours. You know, leaking membrane is directly related with sepsis. It is not related with metabolic or hypoxic ischemic encephalopathy. It is related with sepsis. So they will give you an important clue in the question. So you have to read the question 2 times. First time, then second time. If the question is very big, like 7, 8, 9 line, then what should you do? You should read the question first. You should read the question and the option. In the statistics, one time or 2 times, a question came, a very big question, randomized control trial. Okay, very big question. And you know what is the question? Question was what type of study it is. In the first 3-4 lines, it is written it is a randomized control trial. So do you think you should read full statistics question? The question was what type of trial it is, and the answer was in 3rd line. So if you see it is a very big question like 12-15 line, you don't have time. Just read what is the question and then read the option and then go back to read the answer, to search the answer. The same rule we follow in OET, occupational English testing. When the paragraph is very big, I read first the question, right? But if the paragraph is very small, 2-3 line, then no need, just read the question and answer. Okay. Any confusion, anyone? Okay. Rule number 8. If paper is difficult, you feel sinking, you feel I can't answer, it's very difficult. Don't panic at all. It is difficult for all and result will be better. How? Pass mark will go down because the paper was very difficult. So you will pass. In some time, AKP passing mark is 50%. Sometimes AKP passing mark is 64, 68%. Why? The time when the question paper was very difficult, the pass mark was very low. And the time when the question paper is very easy, pass mark was up higher. Clear? Just give your paper. Try your best. Rule number 9. Very important to do past papers, recalls, and sample paper. And you have to know that, suppose anorexia nervosa. Anorexia nervosa is coming repeatedly. Okay, repeatedly anorexia nervosa is coming. So you know that anorexia nervosa is a very important topic for exam. So what you will do, you will read this anorexia nervosa from guideline. What is the sign symptom? What is the management? Okay, you will read from guideline. That is the ideal way for preparation of AKP. Now we have different kinds of batch, at least 6-7 types of batch. There is recall batch, full course batch, okay, for AKP exam. So anyone you like, you can join. Rule number 10, last rule. Sleep well, drink a lot of water before the exam day. Okay, sorry for this delay. So rule number 10, sleep well and drink a lot of water. Don't stress out. Don't take propanolol or sleeping medicine or any kind of, sleeping medicine, because it will make your brain hanged. Okay. So some people has migraine, some people has hypertension. Try to take the medicine in daytime. Don't take those medicine at night time, because what happens, exam is usually in the morning time. And if your brain is hang out, you cannot think, rationally. So take your medicine at day and sleep well and drink a lot of water. This is our course for AKP. This is the full-time course, full syllabus. And best of luck. Trust on yourself. There is no shortcut for success. Many people, they bully in the YouTube, they bully in the Facebook. I don't care actually for this bullying. I never cared actually what people say. But they say that, tell me 4 books. I will read and pass. I always tell them, there is no shortcut for success. And this is a postgraduate exam. You will be registered in UK. Do you think by reading 4 books, you will manage the pediatrics patient? So I tell them that thing, that there is no shortcut. You have to read very well. You have to be very hardworking, okay? And you have to have a good knowledge in pediatrics. Because after passing the AKP, you will go to clinical exam, okay? You will go to clinical exam, and then what will happen? After passing the clinical exam, you will get GMC registration, and then you will be a registrar in UK, and then 1,000 children will be under your care, because consultants only rely on the registers. Okay, registers are the hardworking people in UK, most hardworking people. Okay, so don't go for shortcut. Okay, some people are solving only recall. They do not bother about the basic ECG, basic EEG. That is very dangerous. Okay, even if you pass now, you will be stuck in job. Many people return back from UK, you know, they cannot survive because of their lack of knowledge, lack of competency. Okay. Okay, someone saying, Madam, please show me the books. Yes. There is no 4 books, doctor. Who is asking, doctor? There is no 4 books. I said people are asking me 4 books, and I said them, there is no shortcut for AKP preparation. At least you need 13, 14 books. Okay. So these are the books. Okay, these are the books you can see here. This is the books. Here, radiology, clinical cases, new format, guidelines, statistics, and for data interpretation, practice exam, and applied knowledge in pediatrics. Okay, this is also you need palliative, ethics, pharma, and pictures. Okay, so we finished our lecture. Now there is question answer session. If anyone has any problem in any part, you can discuss. Okay, I will try my best to answer. Okay, anyone has any question related to AKP exam? Okay, so I hope this session was helpful for all of you. And if you have further question, my WhatsApp number is with you and my groups are with you. So you can ask me any question in the group. Okay.
Ma'am, in AKP exam in paper 1 and paper 2, we need to pass them separately or overall score will be calculated for passing?
Yes, yes, Dr. Murtaza, you joined now, right? Because we discussed this topic that for
Yes.
AKP, paper 1 and paper 2, you need not to pass separately. There is a combined marking. So even if you fail in one paper, pass in another paper, you can combinedly, you can pass.
Okay, okay, ma'am. Fine. Thank you.
And my course is all the round the year, so you can join anytime. Okay. My course, some are recorded sessions I give and some live batches, live classes I'm taking in my batch. So this is all around the year. Okay. You can join anytime. There is no restriction, but better if you join 6 months back. Why? Because we are doing daily group discussion. We are sharing our knowledge in the group. Everyone is discussing in the group. So you need to know the groups. Okay. And please join this channel. This is the Facebook channel, and share this channel with your friends. Why? Because after AKP, you need clinical exam. So you need a good preparation. And I usually notify my meeting in this channel, clinical meeting. I notify in this channel. And this is a Telegram channel that is helpful if you need materials. And the books, someone asking me books again. These are the books, okay, for AKP.
Ma'am, is there any gap limitation in between part 1 and part 2 exam, AKP and Fopentas?
No. Suppose you pass theory part 1 4 years back, 5 years, 7 years, no problem. Because for theory, there is no gap count limited. But for clinical, yes, 7-year gap is limited. Suppose you passed all theory exam, and 7 years, within 7 years, you have to pass clinical exam. But for theory, there is no time limit. Yes, Dr. Mujamil, I have a batch that will start it for next September exam. Yes, you can join and you can message me personally in my WhatsApp. Any more question? These are the books.
Also, ma'am, if we are planning for the February exam, and I also did the SCPS exam recently. So you said 3 months preparation will be enough, but I am little slow in preparation. So should I start now?
Yes, for January exam, you should start now. If you are slow learner, if you are slow or you are very busy, then you give yourself 6 month time. Like if you have exam in January, from July, you should be very serious about your study.
Okay, and either we should give FOP task first or the AKP first. Some people suggest give AKP first, some people suggest FOP task first. So how the preparation start actually? So,
Yeah, for me, actually, I will suggest part one first. I will suggest because AKP, in AKP, many question, my students actually part one students, many part one students, they pass AKP by part one batch only because I teach so extensively in the part one that it covered your part two. So I will suggest you start from part one because in AKP, there are pharma, palliative. How you know these chapters? Maybe you have done FCPS, but you can be very good at X-ray, ECG, but you are not good at palliative, ethics, pharma, statistics. You are not good at these things. So better you start from part one. Okay, any more question? Okay, then we finished, Alhamdulillah. These are the books I showed you. Okay. These are the books that is needed for AKP. And also these are the chapters that will be questioned from these chapters like palliative ethics, pharma, picture, statistics. Okay. And this you have to join these channels for your future preparation. Okay. These are the channels. Okay. So if anyone has no question, then we will end the meeting now. Okay. Inshallah, see you soon.